Legal nurse consultants, or LNCs, are registered nurses who provide expert analysis and consultation within the legal and healthcare systems. They bridge the gap between medicine and law, using their clinical expertise to interpret medical records, evaluate the merits of medical malpractice claims, and provide expert testimony in court. Their insights are invaluable in cases involving personal injury, medical malpractice, product liability, and more. LNCs analyze medical records, identify standards of care, and determine if deviations from those standards occurred, leading to adverse outcomes for patients. Their work helps attorneys understand complex medical issues, build stronger cases, and ultimately seek justice for their clients. In a bustling metropolitan hospital, a routine surgical procedure took an unexpected turn, leaving the patient with permanent nerve damage. The patient, a middle-aged schoolteacher named Miss Sarah Jones, had undergone a laparoscopic cholecystectomy, or gallbladder removal, that resulted in unforeseen complications, impacting her mobility and quality of life. Alleging medical negligence, Miss Jones filed a lawsuit against the surgeon and the hospital. Her attorney sought the expertise of a seasoned legal nurse consultant, Miss Emily Carter, RN, to evaluate the merits of the case. Miss Carter's task was to review the medical records, identify any breaches in the standard of care, and provide expert opinions on the causation of Miss Jones's injuries. Miss Carter meticulously reviewed Miss Jones's medical records, including pre-operative assessments, surgical reports, anesthesia records, and post-operative notes. She scrutinized the surgical technique employed, the instruments used, and the post-operative care provided. Her analysis revealed a critical oversight during the surgery. The surgeon had inadvertently damaged a nerve while dissecting the gallbladder, a known complication but one that is avoidable with proper care. Miss Carter also found discrepancies in the post-operative care. The nursing notes lacked documentation of neurological assessments, which are crucial after such procedures to detect early signs of nerve damage. This delay in diagnosis and treatment likely contributed to the severity of Miss Jones's condition. Armed with Miss Carter's comprehensive analysis and expert opinions, Miss Jones's attorney was able to build a compelling case of medical negligence. Miss Carter's testimony during depositions and potentially at trial would have been crucial in explaining the complex medical details to the jury. Faced with the strength of the evidence presented against them, the surgeon and the hospital chose to settle the case out of court, awarding Miss Jones a significant sum for her pain, suffering, and future medical expenses. The case of Miss Jones highlights the indispensable role of legal nurse consultants in medical malpractice litigation. Their ability to decipher medical jargon, identify deviations from standards of care, and present complex medical information in a clear and concise manner is essential in advocating for justice and ensuring accountability within the healthcare system.